On her bilateral frozen shoulders, she has rheumatoid arthritis in her shoulders. Reach forward and backwards for me, and back all the way. Oop, oop. Okay, good. Arms on top of your head. Okay, can you bring this one further back? Oh, that's good. Whoa. Okay, okay, bring them down. Slowly but surely. Okay, reach forward for me, and then back. Backwards. Ah, it's grinding. Okay, you can relax for me. It catches, it's like a ratchet in there. But on any case, what I'm going to do is, I did the front part of her body, now I'm going to do the back part. And I'm going to try to take this scapula, it's stuck down to her ribs, and try to lift it off. And so I'm just going to whittle away starting here. Pinch. And I'm trying to slide it underneath the scapula. Because the shoulder starts here, goes all the way down to the pelvis, out to the elbow. And so when someone says they have a rotator cuff problem, that's not true, because the rotator cuff is only 4 of the 18 muscles. And if you make that assumption, you're going to fool yourself. And the only way to release a shoulder is to address all 18 muscles, particularly one this contracted. And it's been contracted for how long?
Oh, years.
About?
Well, I started thinking about shoulder replacement about 3 years ago, but before that I was getting regular cortisone shots on my shoulder.
Okay. For all listeners and for you, no steroids in the shoulder. Let me try to explain. Steroids is a toxin, and it will melt all your tissue. It will turn it into soup. And since you said that, now I have a better idea of what we're dealing with. But that's okay, though. Once the vitality returns, then your tissues will fortify again. It may. Ooh.
No, that can
Okay.
My range of motion though, my pain is at least 8-9 years.
Wow. 8-9 years.
Yeah.
Okay. Yeah. See. Now, with my new vision, your case has been neglected. So you've been neglected, and I'm trying to get Medicare to realize that this therapy that I'm doing is not trigger point therapy. It is myofascial release therapy. Oh, okay, that can be a name for it.
Yeah.
Because the idea of a trigger point is valid but invalid. It's much more of an academic concept than anything. And there's just no way I can get all these tight atrophied muscles to what they call strum or twitch. It's just impossible. It's not logical.
But I've been diagnosed with rheumatoid arthritis for 30 years.
Okay. But the shoulders have been tight for...
Oh, 10 years.
Okay.
9 years.
Now, even though this is graphic, this patient is basically Kevlar. She doesn't budge at all, so I can really get into what I need to do. Other folks I need to give laughing gas to or sedate them. Just a little kick there. How we doing?
Good.
Okay, go ahead and reach forward and backwards. Forward, then back.
Much better.
Ooh, okay, good. Forward. Okay, put your palm on your head. Oh, that's good, that's good. And just hold it there just for a second. Excellent. Let me get that right there. You okay?
Yep. Good.
These are the teres, major and minor. Okay, relax it. And good. Okay, just reach out forward for me and then back. Forward and then back. Put your palm on top of your head. Okay, good. Oh, wow, that's real good. You're going to be able to do those exercises. You still do that class?
I do. I go to physical therapy.
I mean, you were at some
Yeah,
nursing
I
home?
was doing in the memory care unit. We were doing little exercises, but no, we haven't been doing that. Yeah. The patients were much more limbo, agile than I.
Okay, you can let it down. Fantastic. Okay, I'm going to get this part too. How are we doing?
Doing great.
Now, I've probably stuck you about 100 times.
All right. The relief is worth it.
You won't be able to drink any water or it'll just leak out all the holes.
Right. I won't take my diuretic today.
Oh, yeah, that's good. You notice I'm pointing not perpendicular, I'm horizontal to her rib cage. Okay. And thank you. Let me turn this off.